to the World of Rare Disease, a show that focuses on awareness and education about rare and complex disorders. My name is Lisa Deck, and I'm a Rare New England committee member and your host for today's show. Today, our show features Tasia Rechisky. From the outside, Tasia looks like the average 27-year-old, but in reality, she lives with a rare, chronic, but for the most part, invisible illness. Today, we will hear about Tasia's rare disease experience and learn more about VLCADD. We're thrilled to welcome you to our show today, Tasia. Thank you for coming.
Thank you so much for having me.
Wonderful. So the first question, because I cannot say it, what does VLCADD stand for?
Right, yes. So VLCADD stands for Very Long Chain Acyl-CoA Dehydrogenase Deficiency. So kind of a mouthful, but
Absolutely.
Everybody calls it VLCADD.
Okay, and can you tell us a little bit about your story? When were you first diagnosed?
Absolutely, yeah. I was diagnosed at a very young age, at 4 months old. I didn't know I had the disease. My parents brought me to the local pediatrician. They thought I had kind of like your average flu or cold. My mom was a first-time mom, so she was being very cautious. I had been, acting kind of lethargic and been having some odd symptoms. So I went there. They ran a variety of tests and really couldn't figure out what was wrong. He definitely thought something was wrong beyond, the average cold or flu, but wasn't sure what it was. All the tests were coming back negative. So he sent me to a local, a bigger regional hospital to get an echocardiogram to kind of see if it was something impacting my heart. Because a lot of the time when it's something with tiredness, they associate it with your heart. Mm-hmm. Unfortunately, before I could make it to that appointment, I went into what they call a metabolic crisis and a coma. I was then medevaced to Boston Children's from New Hampshire, and it was there that more people kind of started working on what was wrong. I was in the cardiology unit. Eventually, they found out that my heart was enlarged 5 times the size it was supposed to be. But again, they thought it was something functionally wrong with my heart. So they suggested, a heart transplant is usually the solution for that. However, there, by some stroke of luck, happened to be 2 fellows who specialize in metabolism and genetics, kind of making their rounds in the hospital. They came by, they read my case file, and, they were like, convinced the cardiology unit, we think we may know what this is, would you let us, run some additional tests? So the tests that they ran back then, they were the kind you had to send away. Boston mm-hmm. Children's didn't have the capacity to do those. The test came back that I did in fact have a genetic metabolic disorder. I was originally diagnosed with LCAD, which is another form of fatty acid oxidation disorder. But eventually, with further testing, they found out it was actually VLCADD.
So that's really a miraculous story that you're there, and it just so happens that somebody comes by with another idea and ultimately diagnoses you, which, in the rare disease world, it's so hard to get that diagnosis. So it's terrible that at 4 months you had to go through this crisis, but wonderful that you had the diagnosis. So you told us what the word means. Tell us a little bit more about the disease, please.
Yeah, absolutely. So obviously in infancy, well, let me start by saying it is a genetic disorder. So it's a recessive autosomal disorder. So both my parents are carriers unknowingly. Mm-hmm. And then I had a 1 in 4 chance of actually getting the disease. And I did. Mm-hmm. So in the early stages in infancy, it often causes cardiomyopathy, which are issues with the heart. And also my intake of fat, which at the time was breast milk, was obviously not something that I could tolerate. It's a disorder where my body can't break down stored fat. So, the average human, they can use sugar, carbohydrates, fat, proteins, and they can break them all down. They have the enzymes to do so. My body is missing Some people are missing the enzymes completely, and some are missing the majority of them to be able to break down kind of in that first cycle of breaking down stored fat. So my body's unable to do that. So after infancy, I stabilized. This first 2 years of my life, I had a feeding tube to make sure that I was getting enough nutrients. And so that was, a big burden on my parents to kind of learn the nuances of having a child with a rare disease, not a lot of known about it at the time, and learning how to deal with that and just like change their life. But after those first 2 years, my health really did stabilize. I was able, through occupational therapy, to learn how to consume food orally again. And my childhood was relatively incident-free, I guess you would say. I always had to take precautions, things like, not fasting. So I always had to carry snacks with me. And, part of me always knew that I was a little bit different. So there was that. As I got older, I started to have some incidents of like low blood sugar. So I would often have to take my blood sugar levels as I was growing older. Now, as an adult, the most prevalent symptoms are muscle breakdown, which they call rhabdomyolysis. Okay. My body essentially starts eating away at the muscle as opposed to the stored fat, which it can't break down. So that can cause, obviously, severe muscle pain and other issues that, if prolonged, can lead to hospitalization and other further like organ issues.
Wow. So that is something that you just, it was kind of a new disease, not disease, but a new diagnosis, and then figuring it out. And it sounds like it's changing as time goes on. So every stage is different. I know we talked prior to this interview, talking a little bit about your adolescence and what that was like. And I think that's something that our viewers would really like to learn about, because there are young people who are going through rare diseases. And I know feeling lonely, feeling like different. And so I'd love you to share a little bit about that, if you would.
Yeah, absolutely. As I mentioned, my childhood was relatively, I guess, symptom-free. I did everything that a normal child did. And I always, like I said, I always knew I was different, but it never really impacted my day-to-day too much. So really, when adolescence came along, that's when my symptoms started to change. My quality of life really started to decrease. I was very active. I played a lot of sports, and slowly but surely it became evident that that was going to be difficult. I was hospitalized quite often, so that included missing a lot of school and missing out on a lot of important like milestone events in my teenage years. Being a teenager is hard enough, and then like having to add on top of it, anything that makes you different can be very, very difficult. Both socially, emotionally, and just physically being unable to participate.
Right.
So it was definitely a shift that was difficult for me, as I'm sure it is for many people. And that was a time in my life that I definitely didn't fully embrace, my rare disease. It took time to kind of adjust to maybe my new I guess they call it like your new normal. Like it took a while to adjust to that and to learn that even though maybe I couldn't do everything everyone did, kind of finding ways to live with this not new disorder, the new symptoms and the new kind of manifestations of it was difficult.
It's interesting. I think I said this to you. I have 2 kids who are a teenager and close to teenage years, and I said, they don't want to stand out at all. You just want to be the same as everybody else. Like no attention, no needed. And I think with the rare disease and symptoms, you do stand out, and that's part of figuring that out. And thank you for sharing that, because I think that is a very common feeling a lot of people have. So today, what is it like to live with VLCADD today?
Today, I've been lucky. I've found that with a disorder like mine, really being regimented and kind of like taking it day by day is really important. And I've been lucky that as I've kind of grown into adulthood and my schedule has become a little bit more structured, as opposed to like college years, which can be very fluid, that I've been able to manage around my disorder, whether it's, taking my medication or controlling my activity level. There's these different things that I kind of can do. And it's allowed me to really live a very fruitful and productive life. And, I work full time. I graduated from college. I have great friends and a great support system. And I've been lucky enough to kind of, branch into this rare disease community and really embrace it and meet a lot of great people who kind of are going through similar things as myself. And that has really made all of the difference. As we know in the rare disease community, like just knowing that you're not alone, that other people have to play that balancing act every day between, their day-to-day life and the symptoms that their disease may bring up.
Yeah, I totally agree. And I think sometimes I know as a patient for the long time I didn't have that peer support. And now that I do, it does make all the difference. So another thing that we talked about was how you have participated in clinical trials. And I'd love to hear more about that.
Yes, absolutely. So at that age, at that adolescent age, I was about, age 11 or 12 is when my symptoms really started to change. The medication that I had been on, which is the standard kind of medication for my disorder, was not seeming to be working the same way it had in the past. And again, why that was really unknown. Your body's changing, things change. I was lucky enough to have a doctor who made the suggestion that at the time there was a medical trial for a new medication. It was brand new at the time. So around age 13, 14, I was able to, my family and myself made the decision. He made it very clear that this was something, it was brand new, kind of the side effects weren't very known, and it was 100% my decision to do this or not. And of course, my parents, being the great support system that they are, they really left it up to me because they knew that this is something that impacted my life and they would support, any decision I made. So I decided to do it because at that point I was like, I would have tried probably just about anything to feel better.
Right.
Because really just like the difference between my quality of life from the past and at that time were drastically different. And so just getting back to some sort of semblance of control over the disorder really helped. So originally the trial was in Baylor University in Dallas, Texas. It has since shifted. So I have actually been on that medical trial for 15 years now. And it has been an active clinical trial that whole entire time.
Right.
So that just goes to show how long sometimes these clinical trials can last, how many phases there are. At first, it was definitely a very big financial burden on my family. It was something that, I had to, they had to pay to, we had to pay to fly to these places and get treatment. So that definitely took its toll. But over time, I was able to, there was just so much benefit to it that we made it work as a family.
Right.
And through the clinical trial, luckily for me, it has worked immensely. Really a night and day difference. Almost immediately in the first couple of weeks, I could already feel the difference, and I was having less hospitalizations, less issues with my symptoms, and it has so far worked in the same capacity since.
Right.
So I've been very lucky. As part of the clinical trial, I recently was able to testify in front of the FDA for that medication, along with some other families. And just meeting with them and hearing their stories, to me, mine was life-changing, but hearing their stories about how, their children or themselves, how they really went from, life or death scenarios, and this medication really brought them that much of a change was amazing. And so we were able to testify to the FDA about this and hopefully move it into an approval phase shortly.
That's something I didn't get to hear before the interview. That's amazing. I
Yeah.
mean, you know, I've heard of people going to FDA and testifying and trying to make that happen, but this is really happening. And I think it's a new kind of way of the world that FDA is reaching out to patients to hear about these things. So that's excellent. Did you feel when you were that young it was such a hard decision, or was it that you just felt so terrible you would, like you said, you would have done anything?
Yeah, I think probably it was a lot harder on my parents to like let me make that
Right.
decision, but for me, and maybe it was because I was so young and like didn't
didn't-
really
you didn't
think about
recognize it all, right.
Yeah, I didn't recognize like kind of like the consequences or like what could be.
What could, right.
And to me, yeah, I was just in the mindset that like if anything could make me feel better, I would do it. And so for me, it was a pretty easy decision. I'm sure, you know, kind of like my support system, it maybe wasn't as easy.
Right.
But they were very supportive.
Excellent. So now today you are, as you just mentioned, you're working full time. You mentioned you're going for an MBA part time. So you have got to a point that life today is relatively stable medically. And is that what to expect, or do you know what the future holds?
Yeah, so I would say, yeah, my life now is relatively stable. This disorder, it can change very quickly. I still, you know, every couple years have, you know, issues with, I have to be hospitalized, and it really comes on kind of rapidly. There's nothing that can really pinpoint why it happens. You know, there's some triggers here and there, but it's really unpredictable. And that can be hard, you know, when living day to day, just trying to figure out, okay, like what can I do to really keep things stable? And you do the best you can, and then after that, you really just learn to kind of work around it.
Right.
The future, that's another thing I don't really know. There are people who are older than me who I've reached out to who do have this disorder. And they kind of say the same, that life is different day to day. But they don't really know exactly what the aging, I guess, process looks like for someone with VLCADD or any other fatty acid oxidation disorder. So I don't know what challenges I have to come, but I feel like I have the tools that I need from,
yeah.
you know, it's changed so much in the past
Right.
that if I need to shift again, I will.
Right.
And we'll see what happens.
Well, I think by minimizing risk and positive attitude and a support system, you are set up for ready to handle anything that comes your way, which
Absolutely.
is really remarkable too, because good for you and good for your support system, because I think, you know, having that is really special. Well, thank you so much
Thank
for
you.
sharing. Before closing, we provide our viewers with an opportunity to share comments or ask questions from our prior shows. Rare New England in Motion is the perfect way to expand upon our mission of engaging with our community. Please send us your questions or comments to info@rarenewengland.org. We will share your responses on our next show. We received a question from our last show. They asked, is a learning disability the only type of special needs a child may have that qualifies them for school support? So we looked that up, and there are actually 4 major types of special needs that qualify a child for school supports. First, there is physical, which includes diagnoses like muscular dystrophy, multiple sclerosis, chronic asthma, or epilepsy. Second type is developmental, such as Down syndrome, autism, dyslexia, or processing disorders. The third diagnosis are behavioral or emotional, such as ADD, bipolar, oppositional defiance disorder. Those can also qualify a child. And finally, children with sensory impairment, such as blindness, visually impaired, deaf, or limited hearing, can qualify. The Federation for Children with Special Needs is a great resource where you can learn more about this subject. If you have a question for Rare in Motion, please send us an email. Thank you for your inquiry. And again, thank you to Tasia for coming here today. From all of us at Rare New England and all the patients and families who keep rare disease in motion, thank you for watching. And remember, when you hear hoofbeats, think horses, then think zebras. Thank you.